Do you sometimes notice small bruises on your child's skin without any fall or bump? Or maybe they get frequent colds and infections that just don't seem to go away. These could be signs that something deeper is going on. One such rare but serious condition is Wiskott-Aldrich syndrome, or WAS. It mostly affects boys and shows up in early childhood. The body struggles to make healthy immune cells and blood clotting parts, leading to easy bruising, frequent infections, and rashes. Think of it like a toolbox where some tools are missing or broken. The body can't fight germs or stop bleeding the way it should. Have you ever seen a toddler with many unexplained bruises? That might be a red flag. What causes Wiskott-Aldrich syndrome? It comes from a tiny mistake in a child's genes, specifically a fault in the WAS gene on the X chromosome. This gene is like a set of instructions for building a protein that helps immune cells move and work properly. When it's broken, the body can't make this protein, so immune cells can't travel to infection sites and blood doesn't clot well. Since it's linked to the X chromosome, it mostly affects boys. Girls can carry the faulty gene, but rarely get very sick. Imagine giving a delivery driver a map with missing roads. They can't reach their destination. That's what happens to immune cells in WAS. Do you know anyone in your family with lifelong immune problems? Genetics might be the reason. How do you know if someone has Wiskott-Aldrich syndrome? Let's play detective. If a baby boy has tiny red spots on the skin called petechiae, big bruises from small bumps, constant ear infections, or bad eczema that won't go away, WAS could be the culprit. They might also have bloody diarrhea or nosebleeds that are hard to stop. These signs usually start before age 1. Picture a child who gets sick every month and always seems to be healing from some small wound. Parents often say he never stays well. The triad of symptoms, weak immune system, low platelets, clotting cells, and skin issues points strongly to WAS. Does this sound like someone you know? First, they run blood tests. They look at the size of platelets. In WAS, they are unusually small. They also check immune cell levels and may do genetic testing to confirm the faulty WAS gene. It is like checking the engine light in a car. Tests help find the real problem. Treatment depends on severity. Antibiotics help fight infections. Some children get IVIG treatment with donated antibodies to boost immunity. For bad cases, the only real cure is a stem cell transplant, replacing the broken immune system with a healthy one from a donor. It is like swapping a broken engine for a new one. If caught early and a matching donor is found, kids can grow up healthy. Have you heard of bone marrow transplants? That is what this is. Can we prevent Wiskott-Aldrich syndrome? Since it is caused by genes, we cannot prevent it like a cold or flu. But families with a history can seek genetic counseling. Imagine you are planning a family, and you know a relative had WAS. A genetic counselor can test parents to see if the mother carries the faulty gene. If yes, they can test a baby before birth. It is like checking the blueprint before building a house. While we cannot stop the gene error, we can prepare, plan for early testing, quick treatment, or even a future transplant. Being aware beats being surprised. Scientists are working hard to find better fixes. One exciting advance is gene therapy. Instead of needing a donor, doctors take the child's own stem cells, fix the broken WAS gene in the lab, and put the cells back. It's like repairing your own car with a brand new part you built. Early trials show kids improve, fewer infections, better platelet counts. Another plus, no need to find a matching donor. Also, better drug treatments and milder transplant methods are reducing risks. Families once had few options, but now hope is growing. Could this be the future of curing genetic diseases? Maybe, and WAS is leading the way.